Welcome to The Savvy Patient, where we make medicine make sense.
I'm Dr. Gillian Goddard. I'm an endocrinologist and an expert in women's hormonal health with 2 decades of clinical experience.
I'm Erin Stein, a writer, editor, filmmaker, and media psychologist, but definitely not a doctor.
By looking at the data and breaking down the research, we will help you get savvy. Remember, this podcast is not meant to replace medical advice from your own doctor. Hello, and welcome to The Savvy Patient. Today, we are talking about boobs and breast cancer.
So this will not be safe for children to listen to. Not because of the boob part, but because I'll be swearing. I'm going to do more of the talking today. So exciting for Gillian.
Yeah. It is exciting for me. I like to be on the other side.
Because I have boobs, but also I had breast cancer last year.
Yeah.
So I am technically a survivor, which still feels very strange to say. Before we talk about our boobs, I'm going to go on a little bit of a rant that I warned Gillian I was going to do, because I've started to see some things on the internets, as it were, suggesting that women do not get mammograms or MRIs, that they should avoid these screenings at all costs. And I don't want to vilify people. Perhaps they are well-intentioned and just misinformed, but that is complete bullshit. Is
Agreed.
a very calm way of saying how I feel about it. Because this is how you catch your cancer and you treat it and then you're fine. That is what happened to me. I would not be totally fine, have zero problems going forward if I hadn't gotten both a mammogram and a breast MRI. Some people are claiming you should not get mammograms because of the radiation. You do get a small dose of radiation.
Really tiny.
That they have studied. And also, do you know how you get radiation? By existing on planet Earth.
Getting on an airplane.
Not even. Walking around in your backyard, you're getting radiation. Yeah. Radiation comes from the earth. Radiation comes from the sun. You are absorbing radiation on a daily basis, and your body is built to deal with it. Now, if you're in a nuclear accident, that's too much radiation. If you're getting a mammogram every day, that's probably too much radiation. But something I saw online was like a mammogram is kind of like an average of a month or two of regular radiation that you're getting just walking around.
Right.
And so...
And an MRI has zero radiation.
That's correct. I don't understand why MRI is categorized in there. There's no radiation in an MRI.
Absolutely zero radiation.
Zero radiation.
And no radiation in ultrasound.
No radiation in ultrasound. So avoiding radiation is not possible.
Correct.
Do not avoid a mammogram because you're worried about the radiation. The benefits far outweigh any negligible risk that may or may not exist. I'm not convinced there is any risk because as long as you're not doing it all the time, which nobody is, you're doing it maximum once a year probably. And a lot of people do it every 2 years, so that's fine. I'm going to try and calm myself down for the rest of the conversation. Get a mammogram.
Get a mammogram.
Get a mammogram. Get a mammogram. And if someone is telling you not to, do not believe them. It's not correct. And also, don't stand on tinfoil to brush your teeth. Okay.
Or to use the microwave.
This is something we're going to come across a lot, actually. People take something and go so far extreme. And so I'm not saying radiation is good. I'm not saying we should be bathing in it. However, there are times when minimal doses of radiation are totally fine. And the fact is we are exposed to radiation all day, every day, just by existing on planet Earth. It occurs naturally on the Earth.
This is one of those things, and I talk about this a lot, where you have to think about not just the risk,
right,
but how the risk is weighed against the benefit and what the effect of doing nothing would be.
Yeah. Doing nothing is worse, objectively. And But also, in my opinion, as Bethany would say, that's my opinion. Also, some people will say, well, since everyone started getting mammograms, everyone's getting breast cancer. No, people are finding their breast cancer and getting it treated. And now the survival rate is 44%, where it was like 18% before.
Yeah. We're finding breast cancer sooner so that we can intervene more effectively.
Yes. And that is the tale I will tell you today of finding breast cancer very early.
Yes.
And dealing with it, in my opinion, quite definitively. When we talk about breast cancer, we are talking about boobs. And so
Indeed.
I mean, yes, obviously, but also our relationship to our boobs.
Yeah.
And so I want to talk about that for a couple minutes at the beginning, because I don't think we talk about that a lot. But when you're a woman dealing with breast cancer, even contemplating having it, like some women don't get a mammogram because they're just afraid. They don't want to know if they have breast cancer, right?
Yeah.
Because it was once upon a time really bad to get breast cancer. We didn't have treatments. Yeah. Surgeons were just cutting off your shoulder muscle and your breast.
Yeah.
I mean, it was a wild, horrible time.
Yeah.
And women were not catching it very early. So by the time it was caught, it was very advanced and it was a death sentence.
Yeah.
So all of these things have changed, but culturally we've absorbed a lot of these messages.
Yeah.
Also, culture ties up being a woman so much to your boobs.
So much.
So much. My entire young life, I was buying padded bras at Victoria's Secret. To try
Pretty sure
to
I was
pretend.
there.
Yes,
when you
I'm
bought
sure Gillian
some of
was with me on some of these trips to Victoria's Secret because I didn't have any boobs. When I got married in my late 20s, I sewed pads into the dress and put cutlets in my bra, and there was still room in there. The dress was so beaded that I couldn't adjust the dress itself, so I was just stuffing to fill the void. My breasts were very small. And so I was embarrassed about them. I thought they weren't big enough. I didn't think I was sexy. I didn't think I was woman enough, because that's the messages we were being given by the once upon a time women's magazines that we were reading. Now the internet and the anime giant boobed figures that we see. In my mind, I didn't care about my boobs. My boobs were a curse upon my existence. They were so annoying. And then in my mid-30s, they started to grow. And I'm like, oh, great. Now I will finally fill out a top, except that they grew unevenly. So one was much bigger than the other, and they were so fucking lopsided and so annoying in a totally different way.
So this is really important to talk about because women don't realize this. Obviously, there are degrees, but all women have some asymmetry. And we don't even have a good sense of how many women have more severe asymmetry and how many women have less severe asymmetry because there's no good studies on it. But when breasts grow in adolescence during puberty, girls can have huge degrees of asymmetry during puberty while breasts are developing, and no one tells them that that's totally normal and that it probably won't stay that way. And women don't talk about the fact that most people have one bigger boob and one smaller boob.
For my fellow lopsided boob ladies out there, I feel you. When they were smaller, I'm sure they weren't 100% the same size, but it was not noticeable, especially when I had a bra on. But as they got larger, even with a bra on, stuffing one side to try and even them out, I said something to a friend once, and she's like, that one. And I'm like, so great. So you can still tell. We went on a beach vacation. I was sewing pads into one side of all of my bathing suits because clothes are not made.
No. For asymmetry.
It is dramatically evident that they are not the same size, and bras are not made in a way that makes it easily adjustable. And the best solution is just stuffing one side. Like the fancy bra you can get just has a pocket to put more stuffing in. Okay. So
yeah,
my boobs and I were not friends. We were not getting along. So when I turned 40, and I started getting a mammogram, I'm like, I don't even care. If I have to take these things off, whatever. I went for my first mammogram like a good little girl, just to pause on getting mammograms, which everybody should do. You just give them your boob and they squish it into this thing and it gets squished between these plates. And it's not that bad.
No, it's really not. Would I do it for fun?
No.
No.
Absolutely not. Is it comfortable? No. For me, it's a little bit painful. I know that some women have more pain, but it is very brief.
It's so short.
And if your kid walked up to you and punched you in the boob, it would probably hurt more, frankly.
Yep.
It is over very quickly, and the technicians usually are very good at handling it. They know everyone's nervous, and they do it quickly, and it's over. So get your mammogram. And then I got a letter in the mail that says, you have dense breast tissue, so you need to come back and get a sonogram.
Oh, fun tip. You can ask your doctor, and this is dense breast tissue is especially common in younger women. So when you're first getting your mammograms in your 40s, ask your doctor to give you the prescription to go for the mammogram and sonogram together so that you don't have to go back and make a second trip.
Yes. So after the first one, I did that every year. I would do both at the same time. So then I got a sonogram. And then they saw some stuff in there. And they're like, we want to biopsy it to make sure we know what it is. And so then I did get nervous. I'm like, oh my God, there's stuff in there, these fucking things. And then I'm like, maybe I don't want to just cut them off. Like, I don't know. Suddenly I was concerned about keeping my boobs, which I had never been concerned about it before because they caused me nothing but grief. But it's a part of your body. It's attached to you. It's a scary thought, and you don't know what's going to happen. And when you're lying there with your arm above your head and they're moving this ultrasound, it's like that movie where the airline attendant is typing on the computer and they're like, let me see if I can find a seat for you. And then they just type and they type and they type and they type. It's kind of like that. You're there and they're looking in there and they're just clicking it. And then they're clicking it and they're still looking in the same spot and they're clicking, because they're taking pictures every time. And you're like, what's happening? What are you seeing?
Well, and the technician's not allowed to say anything to you because the technician is not a doctor. They're an ultrasound technician. And so they literally can't say anything to you.
Yeah, it's disconcerting.
Yes.
The word I would use.
Yeah.
So I would say if you haven't had a sonogram before, just know that they will stand there silently clicking on a keyboard and it's probably fine.
Yeah.
Even if there is something, they're just taking pictures of it for the doctor to look at. It could just be a cyst, a fluid-filled sac, as we discussed in the last episode. So don't panic yet, but it is very strange to be lying there and having this happen. Then I went back for a third time to have biopsies. I think there's different kinds of ways to do the biopsy. Mine had this little, I want to say gun because it makes this noise.
It makes a noise.
They pull a trigger. And
core biopsy.
It's like when you went to the mall when we were kids to get your ears pierced. And it's like cha-ching, right in your ear. It's kind of like that.
Exactly like that. Yeah.
So they put some injections to numb it first, so you don't feel it, and then but the noise is so loud. And they take out little samples. And then they test it, and I had some bruising afterward, and it went away. And so, luckily, the first time they're like, "Okay, so this was a cyst, this is a adenoma, everything was benign."
Yep.
But we checked it all out, fine. Then I keep going every year. I get my mammogram and my sonogram together because I've started asking to get them at the same appointment. And every year we found stuff, and sometimes it was just monitoring the stuff that was there that they had already found. Sometimes they were finding new things. There was stuff in both breasts. So I had a couple more biopsies. I think I had 5 biopsies total. I honestly don't even remember.
In 7 years.
Yeah.
So
everything
almost every time you
benign.
went, you needed a biopsy.
Yeah, almost. But stuff was growing in there, right? So I was prepared for something to happen. It was not a shock to me when breast cancer was found in one of my boobs because these fucking things have been nothing but trouble. Why would it change now? And we keep finding stuff in them. Stuff keeps growing. So we got to the point, there were 2 things, one in each. They were sort of even in this foot. There was always one in each boob. So we
Well,
found
that's
these things.
nice.
Yeah, I know. It's like, now we're going to be even about it. We found something called a PASH, a PASH, which Gillian might be able to pronounce the full name of.
Pseudoangiomatous stromal hyperplasia.
Great. Okay. We found those. Those are benign. However, they are precancerous. They have the
They're high
potential
risk. Yeah.
to develop into cancer. So I was given an option, come back every few months and see if they're bigger or growing. You can just take them out. And I was like, you know what? I vote for taking them out.
Yeah.
I don't want to deal with them. And to be honest, I also thought, well, if there's some sort of surgery involved, maybe I can even up my boobs a little
Right.
bit.
Yep. Take a little more out of one than the other.
Take a little more out of this one when you take the PASH out of there.
Yeah.
So at that point, I was still traveling quite a distance to go to my old gynecologist and screening center. And I said, okay, I'm going to be dealing with more stuff. I want someplace closer to home.
Yep.
So I went looking for a place. I'm very fortunate that I live near not only a hospital that has a breast cancer center, but I found a breast health center. They focus on treating women's boobs. So I met with the breast surgeon, gave them all my scans and all my results, and she said, I agree. I think we should take them out. And so I had 2 lumpectomies, 1 in each boob, and they test them again to make sure there's not anything else going on. And then I went back to mammograms and sonograms. And I'm a person afraid of needles. I don't like shots, let alone surgery. So it was a big deal for me to have those lumpectomies because I'm pretty avoidant of these kinds of.
I don't think you're so unique in that way, but
now a lot of people are like, oh, I just went in and had all this plastic surgery, which is still surgery. And I was always like, never, because I'm not going to volunteer to have you stick a needle in me. So I got through the surgery, and I have to say everyone was wonderful. And as much as I was nervous about it, once they put you under, you're great. It's fine. It's golden.
propofol naps are very nice.
It was wonderful.
There's a reason why Michael Jackson liked his propofol so much.
Yeah, I mean, it's a hell of a drug. It wasn't super long, so I didn't have a huge dose of that stuff. So I only had a little dry mouth when I woke up. Some people have nausea, and then it was just surgery recovery, which did suck. I'm not going to lie. Yeah. So then my great, wonderful doctor said, I want you to start getting a breast MRI. So we were going to alternate, get a mammogram and your sonogram, and then 6 months later get an MRI. That is more helpful if you have dense breast tissue, especially because the reason to do an MRI is it sees things the mammogram and sonogram are not going to say. The mammogram is one thing, but if you have dense tissue, it's not going to see everything in there. So they use the sonogram so they can squish everything around and get a closer look at stuff in there. But they're looking at, I guess, a positive image, essentially, for my photography friends. The MRI takes pictures of your blood flow. That's why you get a little IV, you get some crap.
They use IV contrast. Yep.
And then they take a picture. And so you might see a blank area where the blood has gone around, and that's how they look for stuff with the MRI. So it is very valuable. And in my case, my very first breast MRI, we found 2 spots, 1 in each boob again. One was a little bigger than the other one, but they had not found them on the sonogram. And so then we went back and we did do sonograms for them to try and find them. One they were able to kind of find and put a little marker in there. And the other one they couldn't find on the sonogram. It was so small. We were able to do the core biopsy of the larger one. Came back as breast cancer.
This is a great point at which to kind of talk about the fact that we talk about breast cancer as though it is one thing.
Yes.
But there are actually multiple different types of breast cancer, depending on where the cancer cells came from. So, common types are like ductal carcinoma or lobular carcinoma, and that is because there's different types of cells in the breast that can mutate and become cancer. That's important because different types of cancer carry different types of risk. they may be more or less sensitive to hormones or more or less likely for the cells to have hormone receptors in them. And so how people think through their treatment options at that point will be different based on all of that information. So you had ductal carcinoma.
Mm-hmm. Technically classified as invasive because it was right on the edge of a structure. It hadn't actually invaded into the other structure, but was borderline. I mean, invasive sounds so scary, but it just means where it's positioned
Right.
over your breast. But I saw that on a piece of paper. I was like, ugh, what is that? Is that
Yeah. It
gonna grow
sounds
and take over my
bad.
body? But no,
Right.
that's not what it means. Yeah, so my doctor called me and she said, it's breast cancer. She said, but it's small, it's early, it's treatable. She repeated that to me a couple of times on the phone. It's a very good thing to say to me.
Yes.
Because as much as I was expecting this phone call at some point in my life, it still is not a good feeling.
Of course not.
And it's the uncertainty, right? You don't know. And until you're going through it, you don't know anything about it. And even though I'm telling you my experience today, there's so many other different versions of this experience. And I hope someday we have other women come on and talk. Especially, I would like someone who had triple negative breast cancer to come on and talk. It's very different.
Yeah, it's very different.
So yeah, we talk about it like this one entity, and it's not. And I think one thing is that so much stuff does grow in your boobs. It's not all cancer, but there's a lot of this, in mine at least, there was a lot going on in there.
Some people have very active boobs.
And most of it was fine, but then finally there was something that wasn't fine. So I took my husband with me to the doctor.
Always a good idea when you're getting news like this, where you're going to be getting lots of new information, to take a second set of ears.
It was very nice to have him there, but I also think there is a signal then to the doctor, not that my doctor needed it, because I really think it's like an incredible, incredible doctor, but for some doctors, it's a signal that this is being taken seriously and you need to take your time. There's a family member here. Slow down and walk people through this. And so she did. She was fantastic. Explained everything to me and then laid out my treatment options. Now, the pro and the con of me catching my cancer so early and it being so small, I had a lot of options for ways I could handle this, which in some ways made it much more difficult because I'm like, I have to decide. There isn't just like one best way to deal with this. There was not. There was, I had to make some decisions. So, obviously removing it surgically was number one. Like, yes, we're not going to leave it in there. We're going to take it out.
Although they're not so much with breast cancer, but there are other types of cancer where we do something called active surveillance, where if it is small and doesn't look like it's growing very quickly, we watch it in a very prescribed way. And so some people do sometimes, under very specific circumstances, decide to leave cancer in place and watch it and see what it will do.
And if I was really resistant to having surgery, they probably would have agreed to monitor it for a little while at least. But if it had grown at all, then they would have just made me take it out. Anyway, and I was not, I didn't want to mess around with this. I'm like, just get it out.
Totally fair. That's most people's sentiment. Most people, that's their instinct initially.
As much as you
not wrong.
Don't want to volunteer for surgery, you don't want to have cancer in there, right? So that was one piece that was obvious. But also remember, I had that little tiny one in the other boob that we weren't able to biopsy, so I didn't actually know yet if that was cancer or not.
Right.
And there is also some information you don't know for sure about your cancer until they take it out surgically and test the entire piece.
That's correct.
So that was a little bit like, wait, what? You don't know this yet or that yet?
And they typically will do something called a sentinel node biopsy, where they will inject dye into the cancer, and the dye will then drain into a lymph node, because that's what happens in breasts all the time, whether there's cancer or not. And so then the surgeon during the surgery, goes to find the lymph node, which is usually in your armpit. They will find the dyed lymph node and look for cancer in that lymph node. The way lymph nodes work with breast cancer, if it's not in that lymph node, it's not going to be another lymph node. So you don't have to look at a bunch of lymph nodes. You only have to look at that one.
Yep. And that actually affected what they did for the rest of the surgery.
Right. If they see cancer in that, then they go looking for it in other lymph nodes
So
too.
this is going to be a lot of detail but I think it's helpful just to hear how much detail there is and how much decision making there is to do, even in my case, which was very early and a very common kind of breast cancer. My cancer did not indicate that I needed chemotherapy.
Right.
So I was relieved that was not recommended because I didn't want to do that.
Yeah.
So that was off the table. But depending on what kind of surgery I did and how much surgery I had, radiation was a possibility.
Mm-hmm.
So I could have a simple lumpectomy again, and then you do radiation on that breast.
Right.
Or I could take out all of my breast tissue, and then there's nothing left to worry about growing cancer.
Right.
And so there's no need to do radiation after that. I was not keen on radiation, but also more than that, because my breasts were so active and growing so much stuff, I wasn't convinced another lumpectomy would take care of it.
Well, and you had the thing in the other breast that you didn't know what that was.
Some women really want to preserve their breast tissue, so they'll do the radiation instead. And it's very targeted.
Yep.
It's 10 minutes a day for,
it depends but yeah,
how many weeks you have to go. But the irradiated breast might show some skin changes, some color changes. It won't necessarily match the other one anymore. Yep. And you can even have some tissue changes because of it.
Mm-hmm.
But more than anything for me, I was like, I don't want to have to keep doing this. I don't want to have to keep getting biopsies and keep getting lumpectomies. A factor in this was how I wanted to, if I was going to remove my breast tissue, how did I want to reconstruct my breasts? I didn't want to do implants. Some people want to do them. I didn't want to do them because implants means more surgery because you don't keep them forever.
Right.
You get every at least 10 years, I think you have to replace them.
Depending on the type, they do have to be replaced with some frequency. Yeah.
Yeah. And so also, if you were going to get implants, they would remove your breast tissue and put these tissue expanders in there.
Mm-hmm.
And then you get the implants put in later.
Right.
So again, another surgery.
Right.
Now, there's another thing you can do called a deep flap, and deep is DIEP.
Mm-hmm.
It does not mean they're going deep. It's actually superficial.
Yes.
But they take abdominal tissue, fat, and move it up to your boobs.
Yeah.
And reconstruct your breasts that way.
Yes. DEEP stands for deep inferior epigastric perforator flap.
Gross.
Happy to help.
I feel like more women are taking this option, and I think the practice of it has gotten better. It is now more efficient. It only required a one-night stay in the hospital. It used to require more stays. And my surgeon has done a lot of them, and he did it. He could do it all in one. So basically, I could have one really big surgery where they would remove the breast tissue, and then they would take my abdominal tissue and reconstruct the breast and do it all in one. And then I'm done.
Yep.
No more surgery.
Yeah, I know that was a big factor for you. And
that was a big factor for me because, as I've said, I don't like surgery.
Yeah. I mean, I don't know. I guess there are people who like it, but...
Well, there are people who are less scared of it.
Yeah.
I'm not a fan. I'm scared of it. I'm anxious about it. I don't want to do it. And having surgery has risks too, right?
It does.
So that sounded very good to me. It's still natural tissue. I had some abdominal fat thanks to middle age, but not a lot, because
No.
I'm a naturally pretty thin person, if not bony. So my breasts would be small. You know, if I wanted big boobs or even medium-sized boobs, I would have had to do implants. I have very small boobs again, but I was totally fine with that. All I cared about is that they were the same size.
I love when things come full circle.
Like, I just want them to be pretty close in size. So
Okay.
that's what I opted for because, and I don't know that this is obvious, but because we took out all the breast tissue, I don't have to have mammograms and sonograms anymore because it is not going to grow breast cancer
Right.
because the breast tissue is gone.
Right.
And it doesn't normally grow in your abdominal tissue, I guess.
No. Breast cancer, that would be a weird place even for metastases.
And I guess it's not so much the tissue as the structures, right? The breast structures in there.
So when you think about breasts, what is in there? So there's breast lobules, which are the actual milk producing glands. And then there's breast ducts, which carry the milk to the nipple. The ducts and the glands are the most common cells that cause cancer to arise. And then there's some other structures, other types of glands in there. And then there's some ligaments that in theory hold the whole thing up. And then in between that, there's fat. And so the structures that actually have the possibility of becoming cancerous are the lobules and the ducts.
So I opted for the big ass surgery, had the big ass surgery. That was a bitch. But because I had the lumpectomy before, I definitely had some idea of what to expect, even though it was a bigger deal.
Sure.
I felt a little more confident about getting through it. In a weird way, this all happened in a good order for me to manage my anxiety about it. Gillian mentioned getting your lymph nodes checked. That was the other thing. The deep flap, that was only if they didn't find any cancer in the lymph nodes.
Right.
If they had found cancer in the lymph nodes, I would have had to do radiation.
Right.
So they would
And then
not,
they can't do a reconstruction.
They would not have transplanted the tissue and done the reconstruction. They would have probably put tissue expanders in there as placeholders, and then I would have had radiation, and then I would have had another surgery. So that was sort of like, when I woke up, I'm like, we did it all right.
Yeah, because you don't know going in.
You don't know. So you're,
for sure.
I think they told my husband in the middle of the surgery, but I was still under. That's one thing that you don't know. So there was two possible outcomes, actually, of the surgery going into it. Either doing what you intend to do, or they found some more cancer and you have a plan B. I spent one night in the hospital. For anyone who has to have breast surgery, number one tip I got from someone else, get yourself a little miniature fan to bring with you. I also brought some Pellegrino to the hospital.
I would do that.
The first 24 hours after the surgery are the worst because they're checking you. So there's something called a bear, but that's like, she said to me, you're going to have a bear blanket on you or something. And I was like, I don't know what you're talking about. It turns out it's this like inflatable thing that they put on you with basically what seems like a vacuum cleaner attached to it with a hose, and it's filling it constantly with hot air. So it's like the brand is BA something. So you're wearing this inflatable hot air blanket over your boobs. They're keeping it warm. And it's very noisy, and it tends to slip around, and it's a little irritating, but it's fine, but it makes you hot. And so the personal fan can be helpful. And they didn't keep that on for 24 hours. They kept it on overnight and then finally took it off. But I did not understand what that was, even though somebody told me about it. The other thing that was, to me, the most aggravating, aside from the fact that you have incisions that are painful and on fire, this is specific to the deep flap because I had tissue transplanted. They are checking to make sure that the nerves have been attached, that the tissue is healthy. So they come by once an hour and hold a little like Doppler wand up to your breasts and listen to the blood flow.
Yeah.
And they don't turn the speaker down. The speaker is up very loud and is very crackly.
Whoosh, whoosh, whoosh.
Whoosh, whoosh, whoosh. But also the
Yeah.
crackling from just the machine. It is so loud and annoying. But you're wearing this compression bra after a breast surgery. And it's the one they give you at the hospital is very tight and it has very strong Velcro. And so once an hour, they're coming and ripping it open.
Yeah.
You know, jarring all of your incisions.
Right.
And your new boobs that you just got. So they can stick this thing on there and listen to it. And that was the worst part. That was the worst part.
Yeah.
I hated that so much. I was never so happy to have something be done when they stopped doing it.
Right.
So prepare yourself. But my husband was able to stay overnight in the hospital with me. Not that that was comfortable for him, but I appreciated the company.
Fair.
You're probably not going to sleep much, even though that's all you want to do, because they're going to wake you up every hour.
Yep.
To do that horrible thing and also give you some medications for the pain. But after that 24 hours, when I was able to just go home and lie in bed, it was a lot easier.
Yeah.
And then luckily I had no complications, no infection. I had to deal with surgical drains, which is gross. And you should talk to someone who's had them before.
They are no fun.
They're no fun, but they're also fine.
Yeah.
And again, if you have a husband, deputize them. My husband was on drain duty for a week. And
I'm sure he loved that.
He did not love it at all, but I couldn't bend or twist to do it myself
to do
for
it
the
yourself.
first week. So he was doing it. It's gross, but it's a thing, and you do it, and then it's over. So luckily everything went well, and then I did have a small revision surgery. Part of that was actually this other detail. When they transplant the tissue, they also transplanted a piece of skin that they put underneath the breast. And so you can just leave that there, but it makes this extra diamond-shaped incision. So I had those removed. So now for me, going forward, no mammograms, no sonograms, presumably no more biopsies. And I just get a manual breast exam now every year. I mean, I'm still checking them. I'm still having follow-ups with the breast surgeon. And after whatever treatment you've gone through, surgery, radiation, chemo, all of the above, some combination thereof, then you're usually put on medication.
Well, it depends.
Yes, I said usually. So I'll say what I'm on, and then you can say more about that.
Yeah.
So I'm on Tamoxifen for 5 years. The point of that is to reduce your risk of recurrence. There are different drug protocols based on where you are vis-a-vis menopause.
Yep.
I'm still pre-menopause, so Tamoxifen is the protocol. If you're in menopause, there's a different drug protocol. There are differences between these medications. I was talked through all of that because if I didn't want to take Tamoxifen, I could take the other drug protocol, but I would also then have to take an additional drug to put me into menopause.
That's correct.
Essentially.
That's correct.
So again, more options, more things to think about. A couple of things. One, no one tells you what stage your cancer is.
No, that's not a thing.
Everyone's like, is it stage 1? Is it stage 2? I'm like, I don't know. No one's ever told me. Partly because you don't know everything about it till it comes out of surgery and gets tested.
Yep. That's correct.
And then also the tolerance of these drugs. So Tamoxifen, and I can't remember the name of the other drug, but I'm sure.
And Anastrozole.
Thank you. They are side effects with both of them. And so I talked to my oncologist, and I did not get an oncologist until after this giant surgery.
Yep.
And then I went and talked to an oncologist finally, which does not necessarily make sense. You think you go to the cancer doctor when you get cancer, but I dealt with the breast surgeon and the plastic surgeon, but I dealt with the breast surgeon only at the beginning. And she told me some of these things and some about it. And then she said, now go see an oncologist and get a lot more detail and a lot more discussion. And now the oncologist is the one managing the medication, and I have follow-ups with her. But I did not see her until the end, like what felt like the end, because I got through all the surgery.
Right.
So she walked me through all the medications. Also, you have to consider the medications you are currently taking with it. I was on an antidepressant that might have some contraindication with tamoxifen, so I switched medications before I started tamoxifen.
Mm-hmm.
And then a lot of people have side effects with these drugs. A pretty high percentage can't tolerate tamoxifen. And they will take it for a year and then go off, or they will switch to a different medication. I, again, feel fortunate. I have some side effects, but I'm tolerating it fine. We haven't even gotten to this hormones.
Yes.
So I
Hormones.
went through all of these details, but my breast cancer was estrogen positive and progesterone positive.
Right. So
What
there
does that
are,
mean, Gillian?
yes. So they test the cells for 3 different receptors: estrogen receptors, progesterone receptors, and something called HER2, HER2 receptors. Those are receptors that are in the cancer cells. And when cancers have estrogen or progesterone receptors, they that means that those hormones can, if there's any of those cells left in your body, those hormones, estrogen or progesterone, can bind to those cells and cause them to grow. So the idea of tamoxifen or anastrozole is that and they work differently, but the point is that you're blocking the estrogen from acting on any breast cancer cells that are left in your body anywhere. If there's like microscopic cells someplace, these drugs keep the estrogen from being able to cause those cells to grow and become a clinically significant breast cancer recurrence. They work differently. Tamoxifen is called a selective estrogen receptor modulator, which means that at some estrogen receptors, it blocks the receptor, and at some estrogen receptors, it acts like estrogen. And the benefit of that is that for many women, it has fewer side effects. If you are not postmenopausal, it doesn't affect your periods, and it's better for your bones. Anastrozole prevents other hormones from getting turned into estrogen. So most of the estrogen that we have in our body comes from our ovaries, but our adrenal glands and fat cells actually make some estrogen. And so if someone is postmenopausal, so their ovaries are not making significant estrogen, you can also block those other tissues from making estrogen. And so they basically reduce the estrogen in your body to 0. And we do sometimes use anastrozole in very high-risk types of cancers, even in younger women, but oncologists try to use tamoxifen in premenopausal women anytime that the risk allows for that.
Yeah. And many women can't tolerate it, but many women do. You have to take it and see.
Yep.
And
There's no way to know.
There's no way to know. And so that was a little bit of like, oh, what's going to happen?
Right.
But luckily, I had a little stomach upset for a week or 2. That went away. I find it weirdly kind of suppresses my appetite a bit,
Oh.
which is unusual, I guess, on this drug, but fine.
Okay.
Now that I've moved all my abdominal fat to my boobs, now maybe I won't grow more for the time being. But the other element of this is something called an oncotype score. This is something based on the biopsy and then the more complete lab work done on the entire piece of cancer that they take out. And there are all these calculations done about whether you will benefit from these drugs or not.
Yep.
And you get a number, like you get a little report card and it's like, here's your oncotype score, which is really the level of risk you have for recurrence based on the type of cancer you had. And so if you have a really low oncotype score, you may not feel like you need to go on one of these medications because your risk is already so low. I was considered medium risk, my number. So by taking this drug for 5 years, I'm reducing my risk of recurrence to a single digit.
Yeah.
So to me, that's worth it.
Yeah. But I have a patient, for example, her oncotype score was 6, so that means her risk of recurrence is only 6%, but taking tamoxifen takes it down to 3 or 4%. So she was like, "Well, I'll do it as long as I feel okay." But it
Exactly.
it becomes less critical the lower your risk is. There's also the higher your risk is, the more of a difference it can make whether you take tamoxifen versus an anastrozole. There's some other subtleties to that.
Yeah. And there's so many studies about tamoxifen, but they're all long term.
Mhm.
So they say 5 or 10 years because that's what the research we have talks about. But there's
That's correct.
probably some benefit even if you only take it for a year or
Right.
two. We just
Right.
can't say that for sure
Right.
because they
Yeah.
haven't studied it that way. There are so many different kinds of breast cancer.
Mhm.
And this these things I walked you through are sort of the basics. And I've talked to a lot of other women who have gone through breast cancer. All of our cancers were different.
Mhm.
Everyone has different treatments that they chose and were recommended to them.
Yep.
And so it's a little bit of a menu of items at each step of the way.
Yeah.
And it's guided by what you are diagnosed with. But also, in my case, if you catch it early, you do have options and you do have decisions to make, which is, as I said, somewhat overwhelming. It's your body, you're making these choices. And the farther along your cancer is, I think that changes things. But
Sure.
mine was super early. And some people were like, why did you do such a drastic surgery? It was so early and it was such a tiny thing. My context was I had shit going on in my boobs and I wouldn't
Right.
deal with it anymore. Like, I don't want my
Yeah.
life to be defined by checking my boobs all the time. And if I left the tissue there, chances are I would just grow some more cancer at some other point.
I mean, yeah, I think the chances were good that
We're
that
good.
would have been the case.
And luckily, I still have some boobs to put in a bathing suit. They're much smaller, and I'm fine with that because I lived a lot of life with some very small boobs. And now in
And
middle
they're the same
age,
size.
I don't feel like I need to get a Victoria's Secret padded bra. I think I'm fine. I'm very lucky that I have the health insurance that I have, which
Mhm.
at this point is actually better than any other health insurance I've ever had. And so a lot of this was covered and I did not pay a lot of money. And so
Yeah.
I was grateful, but also I know that I'm lucky that that's true. So I don't know for other women how much of the reconstruction would be covered, but I do know
Right.
it is covered more often. Another factor for me is that I had a history of breast cancer on both sides of my family.
Mhm.
And even when I was getting mammograms, I told them that. And so that was always in my record. You tend to get more covered.
Yeah.
You get more screenings. Like the breast MRI that I had was
Yep.
covered because I had a family history on both sides.
Yep.
So if you do, tell them.
Yeah.
No
Family
one's.
history is actually really important
It's
in
really
breast
important. And
cancer.
also, all you have to do is tell them. No one's asking for paperwork or anything else.
Yeah.
Just say my grandmother or my aunt or my mom or,
Yep.
if you have a family history, put that in there. It helps. And it helps with your insurance. I do want to talk about what causes your breast cancer. Where did it come from?
Yes.
It didn't come from my mammogram. I can tell you that.
That's correct.
And my breast surgeon said the reality is 90% or 90+% of breast cancer is environmental, caused by environmental factors.
Yeah, so I think the way a lot of us think about this, and we talked about this a little bit, a lot of times you have a genetic susceptibility, but then something has to trigger those cells with that genetic susceptibility to actually become cancer cells. So, and that typically is something environmental. We don't know what all those triggers are. I wouldn't even say we know what most of those triggers are, but it's the combination of having the right genetics and having that environmental hit, whatever that might be.
And another element of this is genetic testing. I was thinking about it, but I hadn't done it yet. And then when I got the diagnosis, we went ahead and did it then.
Mm-hmm.
Because if it did show up that I had a genetic predisposition or had the genes active, that could have informed my treatment that I chose as well. So we did go through that test to get all the information possible. But you may want to do that proactively and then be more vigilant with your monitoring of your breasts. They also tell women with Ashkenazi Jewish heritage that you should definitely be tested because unfortunately the risk is much higher.
Yeah. Yes, the risk is much higher.
My breast cancer doctor has signs on every wall in every room that if you have this heritage, you should get tested.
Yep. It's just the genetics. It's just a surrogate way of saying your genetics put you at higher risk of having these mutations that really confer significant breast cancer risk.
Yes. But I think what's interesting is that breast cancer has always existed. In ancient times, even.
Yeah.
There's ancient burials where they've dug up and found what would be considered breast cancer.
Yeah.
So it's not new. So
No.
environmental factors, I would agree we have some extra ones happening in our industrial
Almost certainly, yes.
toxic waste age, but it's not like we never got it before.
No, there are naturally occurring environmental factors.
Yes. And Gillian and I were talking about carcinogens and things that cause cancer, and she's like, well, campfire in a cave.
Yes. Yep. Campfire in a cave.
So we've always had carcinogens.
Yeah. I mean, and like imagine if you were barbecuing inside.
Yeah. Mm-hmm.
You know, it's kind of what they were doing.
Mammoth. Yeah.
Exactly. Yep.
So all of that is to say, it is scary, but I feel like it's emotionally scary, and it doesn't have to be as medically scary as it was once in the past.
Yes.
There are so many screening methods we now have to catch it early. There are so many ways to treat it now. The treatments are so much more tolerable than they used to be. Please check your boobs. Check your boobs.
Check your boobs. Check your boobs.
Check your boobs. That's the main message. This is a big topic, and this conversation was based on my experience. That is singular. That is certainly not everyone's experience, and it does not make me an expert on anyone else's breast cancer, but there were some milestones along the way that I thought would be helpful to share if you are ever navigating this.
Your experience is real, and you deserve to feel your best.
Help us help you get savvy. Send us topics and questions using the email address askask@thesavvypatient.com.
Listen to new episodes on Wednesdays.
Follow us on all the things.
And subscribe to the Savvy Patient Substack.
Please rate, like, and subscribe. And tell all of your friends.